How does hemostasis stop diverticular bleeding? Imagine a tiny tear in a blood vessel inside a diverticulum, which is a small pouch in the colon wall. When this happens, blood can start to flow out, causing bleeding. Hemostasis is the body's way of stopping that bleeding and helping the tissue heal. It works through a combination of mechanical, chemical, and natural processes to seal the ruptured vessel and prevent further blood loss. First, doctors need to find exactly where the bleeding is coming from. They often use a colonoscope, a flexible tube with a camera, to look inside the colon. Once they spot the bleeding or signs of recent bleeding, like clots or visible vessels, they can decide on the best way to stop it. One common method is mechanical hemostasis, which involves physically closing the bleeding vessel. Metal clips are often used. These tiny clips are placed directly on the bleeding site to pinch the vessel shut. Another technique is band ligation, where an elastic band is placed around the base of the bleeding diverticulum to cut off blood flow. Sometimes, doctors inject medications like epinephrine, which causes blood vessels to constrict, reducing blood flow and helping to control bleeding quickly. In recent years, new materials called hemostatic agents have been developed. These include solutions that form a gel or hydrogel on contact with blood. These gels create a physical barrier over the bleeding site, encouraging clot formation and sealing the vessel. These methods have shown promising results, especially in difficult cases or when traditional techniques are less effective. Alongside these interventions, the body's natural clotting system kicks in. Platelets, small blood cells, gather at the injury site and stick together to form a plug. Fibrin, a protein in blood, then forms a mesh that stabilizes the clot. This combined effort helps to permanently seal the vessel and stop the bleeding. To prevent rebleeding, doctors often confirm that the bleeding has stopped completely. They may use tools like Doppler ultrasound probes to check blood flow in the area. Ensuring the vessel is fully sealed reduces the chance of the bleeding starting again. In cases where diverticulitis, which is inflammation of the diverticula, causes damage to blood vessels, hemostasis becomes even more important. Inflammation can weaken vessel walls, making bleeding more likely. Effective hemostasis not only stops the bleeding but also helps protect the tissue from further injury and complications. Overall, hemostasis stops diverticular bleeding by physically sealing the ruptured arteries with clips or bands, chemically constricting vessels with medications, or using advanced materials that promote clotting. These methods work together with the body's natural processes to quickly control bleeding, promote healing, and reduce the risk of recurrence. Always remember, if you experience symptoms of diverticular bleeding, seeking prompt medical care is essential for safe and effective treatment.